Hello, my name is Solomay Tibabu. I'm the host of the Going Digital Behavioral Health Tech Conference. I'm so thrilled to have Dr. Dana Udall here, Chief Clinical Officer of Ginger. Welcome, Dana.
Thanks so much for having me. I'm excited to be here.
And thanks again. Welcome back for another year at Going Digital. For the folks that aren't quite familiar with Ginger, can you give a brief introduction?
Absolutely. So Ginger is an on-demand mental health system. And what that means is that people can get care at the moment of need. They can download the app and start talking with a coach within a minute or two. And then we have therapy and psychiatry all within a collaborative care model. So it's really easy to access, low friction. People are often chatting with coaches on their lunch break or after they've put the kiddos to bed at night. So super easy and accessible for folks, and really want to make it a welcoming space for people during their mental health journey.
And since last year, what are some of the top new developments that have happened at Ginger?
Yeah, it's been an exciting year in telehealth in general, and we are definitely feeling that in Ginger. So in April of this year, we closed a $100 million round of funding led by Blackstone. So super exciting to get that. That is really going to allow us to scale, provide care to more and more people, to really expand our offering. We've also had some exciting partnerships. So we launched with Cigna recently, and that means that up to 14 million Cigna members will have access to Ginger. So really incredible. But what's really most important is that Cigna is the first national health company to use CPT codes to pay for coaching. So huge sort of milestone for the field of coaching. Coaching is such a scalable resource that allows people to get care early. So this is really monumental. We're super excited about that. And then the third thing I'd say is that we partnered with a group called Capsule, and Capsule does mail order medication. So for Ginger members who are seeing a psychiatrist and need medication, they can have their medications delivered to their doorstep. And most of us have gotten so used to getting deliveries over the past year, and it's hard for people to stay compliant with medication, to take it on a regular basis. So this is a really easy way of ensuring that people have their medication at the ready. They can stay on it consistently and really get those benefits that they get. So helpful for members, helpful for our psychiatrists, kind of a win-win all around.
Super exciting news about coaching. Wow, really like the use of coaching throughout the Ginger program. What are all of the different roles in your care team? If you could expand on that a little more, and how do they work together?
Absolutely. So part of the Ginger value is really offering a diverse kind of set of experiences, a diverse platform of experiences. We offer content that can be self-service, but most members start with a coach. And what that means is that they come onto our system, they're greeted by a coach. Coaches are extremely well qualified. They typically have a master's degree. Many of them have the National Coach Certification. They are really curating that content and helping people along the way. So they meet members, they greet them, they help them come up with a care plan, they determine what the needs are, and then they're escalating to therapy or psychiatry as needed. So we also have licensed therapists and psychiatrists as part of the Ginger team. Everybody is working in collaboration and in concert. And the reason that's important is that in mental health, often you have one person treating something and then somebody else doing something else, no coordination. So people are working at odds. There's not a great way of really tracking member progress. But the other thing that's so helpful about coaches is that they provide in between session check-ins. So they can say, hey, how's it going? Did you get to your appointment? I see you're working on this with your therapist. Let's do some relaxation exercises because I think that's going to be really helpful. And then they provide that step down. For many people, when they're in therapy or psych, treatment ends and then they don't really have anything. And so they're just kind of left with nothing. And coaching is that great option that really lasts for a longer period of time. And it's so flexible that people can stop and start and have that when they step down from clinical care. So it's really an excellent resource. And it is that collaborative care model that helps people get better more quickly on our Ginger system.
Excellent. And speaking of patient progress, can you talk a little bit about clinical outcomes? How is Ginger tracking clinical outcomes?
Absolutely. It's something that we spend a lot of time thinking about and investing in. So we use the PHQ-9 and the GAD-7, which are two industry standard measurements for anxiety and depression. And those are two of the most common things that people experience on our Ginger system, but also just, on a sort of global level, people are anxious and depressed, and especially this year. So we're measuring throughout a member's journey on our system. And so that's when they come in, we're getting a baseline, understanding how they're doing. and then regularly surveying them to understand, is care working? Are they getting better? And that helps us for a couple of reasons. It helps us so we can understand the members' progress. So if we see that somebody's scores are not decreasing or they're getting worse, that might mean we need to change the treatment plan. We might add in psychiatry or increase the frequency of sessions. It also helps us understand at an aggregate level, how are we providing care as a system? How are we performing? Are our providers providing high quality care, and are people getting better? And we report out to employers on a regular basis. So they're saying, for my employees, this is how they're doing on the Ginger system. So it's really helpful for them to understand, are people getting better? What are the things that people are dealing with? So all of that data is really informative to us. And then we feed it back to the employers, who I think love to know as well how their folks are doing.
Related to that, can you talk about how Ginger uses clinical outcomes to demonstrate ROI for your services?
Yes, so we have been thinking and talking a lot about ROI recently, and we did some really important work with an actuarial firm where we were looking at claims data from the general population, and we were looking at mental health spend as well as medical spend. And we know that there is a high correlation. There's a lot of comorbidity between mental health and medical issues. So, for example, if somebody has diabetes, there is a likelihood that they may have major depressive disorder as well. And we know that if the mental health issues are not treated, the medical spend can go up. And that's really what we found, is that mental health spend can increase overall medical spend. So we looked at that data, and then we looked at our clinical outcomes, and that's where we came up with this 4.2 or ROI. So it's really exciting. And I think part of the value is that people are accessing care early on. They're getting their needs met, and that allows us to demonstrate those outcomes. They don't have to wait until there's a crisis or they need a therapy appointment. They can start with a coach, get that collaborative care, and then really get better over a briefer period of time.
So, this March, you announced the launch of a value-based care model. Can you go into more detail on how that works and successes you've had so far?
Absolutely. So value-based care is really important. And, in the history of mental health, there have not been as many measurement-based programs. So there hasn't been as much of a focus on outcomes and metrics. So that means that clinicians have often had to lean on their own clinical judgment, sort of guessing if people are getting better. And the field is becoming much more measurement-based. That's important because we're looking not at the length of care or the amount of care, but really when people are getting better. So what we launched was a single offering that includes all levels of care. So content, coaching, therapy, and psychiatry, all within one bundle. And what that means is that many people who wouldn't get access to care are able to do so, or they might get a little bit of care, but because it's all included, it really helps our providers focus on outcomes. And it's been really effective in the market. So over the past year, 60% of new Ginger clients have opted to go with this packaging. So I think it's really resonating with the market, and people are really taking advantage of it and getting better. So it's been kind of a win all around.
You alluded a little bit to this earlier, but can you tell our audience a little bit more about why value-based care is important for the industry?
I think it really has to do with outcomes, as I mentioned, that, we need to show that people are getting better. Some people benefit from mental health services and we don't know why, but there's an awful lot that are not necessarily benefiting. And so if you're not in a care system where there's demonstrated outcomes, excuse me, then you might not be getting better. And that really harms the individual. So somebody might be stuck in care for a long time. We see this, for example, in therapy, that sometimes people stay in therapy for a long time, but there's kind of diminishing returns. They're not necessarily getting better. And nobody's really looking at the treatment plan or the metrics. So I think as a field, we're becoming much more measurement based. And I think that's really important for the public so that they know, I'm going to a high quality provider. I can rest assured that I'm going to get better.
Definitely, it seems like value-based care is becoming more and more commonplace, thankfully. In terms of what else you see Ginger adopting in the future, any things that you're excited about in particular?
Yeah, there's actually three things that come to mind. The first is that we are rolling out services to adolescents very soon. We're doing a pilot soon. So that is extremely important. We know that adolescents, and I know they're near and dear to your heart, they are an underserved population. So it is hard for them to get care at all levels. When you think about especially psychiatry, it is just a huge supply-demand imbalance. So hard for adolescents to get care. We think that the text-based method of coaching will be really intuitive and really easily adopted by them. And we will have therapy and psychiatry as well. So that's super exciting. The other thing that we're working to roll out is Spanish-speaking services. So we know that in order to fulfill our mission where mental health is not an obstacle, we need to provide care to a very wide range of people. And so that means offering services in various languages. So we're staffing up, making sure that we have coaches and clinicians and content all in Spanish. So that's going to be an offering. And then one of the things that I am also incredibly excited about is something that we're calling the Ginger Training Institute. So starting this fall, we're going to have postdoctoral fellows and practicum students. So these are graduate students in psychology who are getting their doctorate, and they will come to Ginger and provide care. So they will be working as clinicians in our system, being highly trained. They will have a cohort group. 3 of them are going to be focused on DEI. 1 of them is going to be focused on research. So we're really excited about that group. And then we're doing a bunch of coach training things as well. So lots of things that are in the works and really will help us, again, expand to more folks, make sure that we have a great pipeline in terms of coaches and clinicians to hire, and that we can really work with as many people as we're able to.
Wow, so many exciting solutions and programs coming up. Can you talk a little bit about what are some of the issues still in mental health?
Yeah. You know, one of the biggies when we think about this a lot is the supply-demand imbalance. And, that's not news necessarily, but we just see that play out all the time. And part of what we're really trying to solve for at Ginger is that exact problem by using the coaching layer, by using content, by really creating a scalable system, because we know that there are these provider shortages. So that's a known issue. One of the other things that we're thinking a lot about is the lack of integration between behavioral health and other medical health. So, for example, we have a partnership with Accolade that we launched not long ago, and that allows us to integrate and ensure that people with mental health issues are getting primary and secondary care as needed. So that's been a really profound offering, and I think it really allows us to move toward more collaboration, better integration, again, addressing those medical and mental health comorbidities that we chatted about.
Let's go 5 years into the future, 2026. What does Ginger or behavioral health look like?
Well, I think at Ginger, we are continuing on in our mission, providing care to more and more folks. Probably will have more languages on the roadmap, different populations we're able to support and work with. And I think in general behavioral health, that integration with medical systems will be really important as well. We're doing a lot of work with health plans and payers. And I think that's also important because so many people in our country get their benefits through payers. So I think that's going to be an important part of the healthcare ecosystem that we're working with as well. So and then I think more innovation overall. So thinking about how do we continue to innovate on care? How do we create more modalities, really make it accessible and culturally responsive? So that's something we think about as well, is how do we both have a diverse pool of coaches and clinicians so that our workforce represents the general public. We want people to be able to come in, see people who have had a similar lived experience to them and have that partnership if that's what they're looking for. We do a lot of training on culturally responsive care as well. So that's something that's core to our mission, and I think to many of the players in the field. So I think that will also just kind of continue to expand, hopefully so that we can create access and really ensure that underrepresented groups are able to really get their mental health needs met.
Yes, that is definitely one that I'm excited to support. And as always, Dr. Udall, this is really exciting to hear all of these great updates from Ginger. Really appreciate your time and sharing all of your insights here with us today.
Thanks so much for having me. It's been great.